Thank you so much for your time today, Dr. Emmanouil. Would you mind just to give us a brief background about who you are, your training?
Thank you so much, Emily, and I'm really glad to be with you here today. As we have discussed many times about my previous career, I'm one of the consultant hematologists and bone marrow transplant in American hospital now in Dubai. But obviously we come from a common ground, the UK, the NHS system, where I've been there for about 18 years. As the head of the department in the bone marrow transplant.
Wow.
And also the divisional director for broader spectrum of specialties there, including hematology, bone marrow transplant, but also some other specialties within my management expertise. So at the moment in Dubai, I'm the program director for the bone marrow transplant department at American Hospital Dubai, which is part of our cancer center at American Hospital. And I must admit, we had lots of discussions before about the challenges. I moved from the UK to Greece for a couple of years. I found that the landscape was very difficult there. And I must admit, if I was not coming here, I was very, very close to actually stop my medical career because we were used to different standards.
Yes.
And that's what we found here.
Yes. And why was the American Hospital in Dubai one of the best matches for your particular skills and experience?
I think American Hospital in Dubai has a long-term reputation about oncology care and hematology care. And also, when I had the interview, they explained to me what they were looking for. They had very clear aims.
Yes.
They had like the vision to create a comprehensive cancer center. And when we say comprehensive cancer center, it's not about only just giving like daily chemotherapy, but you need to give the daily chemotherapy. You have to manage the side effects of the chemotherapy. And you also need to treat patients that are expected to stay in for longer, like acute leukemia patients. Last year, for example, we had 12 acute leukemia patients being treated at American Hospital. And of course, to set up the bone marrow transplant program, before there was an autologous stem cell transplant program in American Hospital, but now they wanted a more comprehensive transplant program to include the allogeneic transplants, like from different donors, rather than the patient's stem cells. Yeah. And of course, to also develop the cellular therapies, which is over the last 5 years in hematology, they gained a lot of momentum, and certainly they are life-saving for the patients.
And could you just tell us a little bit more about bone marrow transplantation or stem cell therapy, and what kinds of conditions it can be used to treat?
Again, this is an area that you need to have significant expertise because it treats patients who have very difficult diseases. So the autologous stem cell transplants are usually for patients who have lymphomas and myelomas. The allogeneic stem cell transplants are usually for patients who have acute leukemias. Some other hematological malignancies like myelodysplastic syndrome, which is like a pre-leukemic condition, although it has a broader spectrum, but the sort of higher risk ones are like a pre-leukemic condition. Some other myeloproliferative disorders. And of course, there are some benign disorders like aplastic anemia or thalassemia and sickle cell, although the last two diseases are usually treated during the pediatric age. But primarily our work, 90%, is malignant hematology disorders that go either for autologous or allogeneic stem cell transplant. And I think within the next couple of months, we will have all the setup for the CAR T cells that will be treating patients with lymphomas mainly and acute lymphoblastic leukemia that have been very refractory to other treatments. These patients never had a hope before. Now there's a hope. And the thing is that this hope comes within the Dubai population. You have a very young population, and therefore the outcomes are expected to be much better.
And how is stem cell transplantation expanding at the American Hospital in Dubai?
So between 2021 and 2023, there were about 17 autologous stem cell transplants performed. From March 2024 until now, we have done 5. We are in the 6th allogeneic transplant patient, and we have done about 13 autologous transplant patients. Wow. So we're close to 20 within a year, which is really good. It's a very good number. But that's because, we have, from one perspective, the management is very supportive. We have a very supportive CEO, very supportive CMO, and very supportive Chief Operating Officer. And also with our department, we have Dr. Maroon and Dr. Han, who have been there for many, many years. And they have different leadership roles. And also the director of our clinic, Mahmoud, who's also helping a lot. But also like the staff is like one team.
Yes.
And I think this is where we can actually work. Probably you have interviewed surgeons and like robotic surgery is very sort of has evolved massively over the last 5 years. In transplantation, unfortunately, there's no like devices that are involved, but it's mainly about training of the staff,
right,
staff turnover and education of the staff.
Yes.
That's what makes a department a really sort of, I would say, a department full of expertise.
Yes.
And also developing the best outcomes for the patients.
Yes.
And also it's very important that we have colleagues all across Dubai that we work as a team.
Yes.
It's not about us doing the transplant only. For example, you have Dubai Hospital, you have Al Zahra Hospital, you have Clemenceau, you have Saudi German, all the other hospitals that are referring patients to us. It's very important that they do an excellent job because these hospitals will send you the patients and you know that these patients are treated well according to the international guidelines and protocols.
Yes.
And that actually makes the transplant more sort of effective for these patients.
Wow.
So as you can see, it's a very broad teamwork.
Yes.
And we really need to have the teamwork for the success.
And how would you say the patient population is different here in the UAE compared to UK or Europe, for example?
So I can give you a very simple example where in the UK, I've done a 75-year-old, the transplant. Here, I've probably seen 2 patients in total with some hematological problems who are above the age of 75, not like even for a transplant. So the population in Dubai is a very young population.
Yeah.
The majority of it is less than the age of 60. Mm-hmm. So usually less than the age of 60, you do see that they have less comorbidities.
Yes.
When patients have less comorbidities, then you're actually taking away some of the risks that are associated with the transplant, which is excellent. On the other hand, you have a very diverse ethnic population. And then for the transplants, you need to have a donor.
Okay.
So a fully matched donor would be the ideal scenario. And initially what we do is we look into the family, and especially the siblings. Each sibling has 25% chances of being a fully matched with the patient. And then if we don't find any siblings, there are 2 options. We actually look into the international registry of bone marrow donors. So at the moment, there are about 35 million donors worldwide.
Okay.
The issue is that the Asian representation within this bone marrow transplant donor registry is quite low.
Okay.
And this is where I think both within the region, and we have already discussions with DHA about setting up bone marrow transplant registries, but also it's about educating the public that this is something which is very simple. It doesn't involve any operation.
Yeah.
And it is so beneficial for the patient to have a donor that is fully matched. About 5 weeks ago, we did the first unrelated donor transplant in adults.
Wow.
In UAE. So we imported the cells from Germany for a lady who was coming from Egypt. So it was Germany that we had the cells. Probably the actual sort of donor was of Egyptian origin, but the donor was actually harvested, the stem cells, in Germany. And what we only had were the cells that were transported from Germany to our hospital.
Wow.
To be given to the patient. The patient's well discharged. Of course, there's a long way to go, but so far she's done amazingly well. And there's one thing. This is a lady that she had acute leukemia, and that happened 4 months after she delivered her first baby.
Wow.
So you can imagine how stressful, I would say not disappointment, but sometimes patients do feel helpless. They don't, like when they hear the diagnosis, they're helpless. And the actual sort of pathway can be so complicated that we really need to explain to them very thoroughly from day one what we are going to do. But certainly having all these all these donors. With the diverse population here, if there are more donors being registered, and also the fact that Dubai is a young population with less comorbidities, it will make a really sort of, I would say, a center of excellence, an international sort of reference center. We've already been registered with EBMT, and we now have a number as a center, so we are within the map.
Registered with what, sorry?
EBMT is the European Bone Marrow Transplant Organization.
Wow, when did that happen?
So that happened 2 weeks ago.
Congratulations.
Thank you. So we do, and we do it in a structured way. We don't rush, but we need to do things in an organized way. And then also we are in the process of being accredited by FACT, which is the American Stem Cell Transplant Organization, and this is the highest accreditation you can have, and that's what we are aiming for. So probably by July, August, we'll have this accreditation.
Wow. So do you see many patients traveling to Dubai from other countries?
Yes, so there are other patients coming to Dubai. We had patients who mainly come from Asia, like from India, from Pakistan. We have also many patients coming from Africa, from African countries. The infrastructure in Africa will not support like a stem cell center, apart from South Africa, that they do have a stem cell center. But for a whole continent, there are very, very few areas that you can have the transplant. So it's very, I would say, the access of these patients to the fully comprehensive cancer care, as we said earlier, it's really sort of low. And that's why we have the patients coming here. And I think the reputation of the American hospital, because of the fact that you have strict criteria in terms of quality, you really need to have quality management. You really need to have your KPIs and to actually make sure that you have the KPIs in the range that you want them to be. And if they're not, to actually try to improve them. Without the data, you cannot really achieve this. And looking at the expertise for the clinicians, nurses, management, they've all sort of worked in top centers across the world. So that's a significant thing for patient care. And I think that's where the patients from other countries come, because they do find this expertise and they do find that these people have worked in really sort of massive organizations, very well reputable organizations, plus the fact that we also have the collaboration with the Mayo Clinic. And Mayo Clinic is one of the top 3 brands in the world about healthcare, and especially about cancer care. So I think that also makes things happen. If there is like any difficulty, we have something called the tumor board with the Mayo Clinic, and we present the cases. So we have like a wider board with the clinicians from American Hospital and the clinicians from the Mayo Clinic.
Oh, wow. So there's a really strong affiliation.
So there's a very strong affiliation, with more plans for the future, even on education.
Wow. Yes, I heard. I heard about the plans coming up in the future. And how was your experience working with Allocation Assist?
The experience has been great from the beginning. I think the way we've spoken the first time, the way we have proceeded with the right hospital, matching the skills, as you said earlier, because there's no point going to a hospital that you have like the transplant experience and you're going to become like a level 1, as we say in the UK, where you just give like some mild form of chemotherapy and don't expect like significant sort of side effects from this treatment. And I think that's where Allocation Assist has done a great job, because rather than placing you anywhere, place you in the right hospital for the right skills. Then, as you know, there was like a package that you told me about the different areas in Dubai. I think I can't remember whether it was Osama that sent it to me or somebody else, about even like the economic type of breakdown about the rents, about the pros and cons of every different place in Dubai that you can actually live. So, even this has made my life very, very easy, and to adapt myself to the environment. Plus the fact that Dubai has amazing sort of services in order to have a quality of life. So I think with your help, and also like with what's happening here, that for me was, as I said earlier, I was like a click away from quitting medicine, and now I'm in a completely different pathway.
Yeah, thank you. Yeah, I'm so happy you're here.
Thank you.
Yeah.
Me too. Thank
Yeah.
you.